स्लाइड है ना, वो आप रोटेट करना, क्योंकि सर मोबाइल से ज्वाइन हुए हैं और मैं भी मोबाइल से हूँ।
तो स्लाइड मैम आप कर पाओगी वहां से स्लाइड?
मैंने ऑलरेडी संदीप सर से बात की थी उनको, एक्चुअली सर अभी
मैं स्लाइड शेयर कर दूँ।
ठीक है सर, ठीक है। थैंक यू मैम, थैंक यू मैम, थैंक यू मैम।
ओके।
So now we'll start.
सर मुझे स्क्रीन का प्लीज बताइएगा, विजिबल हो गया तो।
हाँ, विजिबल।
ठीक है सर।
हाँ ठीक है मेरे।
ओके सर, मुझे जब भी स्लाइड से चेंज करनी हो मुझे बता दीजिएगा।
मैं सर नेक्स्ट बोलते जाएंगे, ठीक है?
हाँ हाँ चलेगा सर। ओके
ओके। So first of all, good afternoon all of you and all of participant doctors. I am Sunil Dave as area manager Ahmedabad MedFarm division, and my sales manager are also there, and Mr. Tarak Vaishnav. So and my speaker,
सुनील
yes,
सर, ये
yes.
पीछे ना बहुत इको हो रहा है किसी का, वो थोड़ा देखिए।
हाँ एक्चुअली सर के साथ ही हूँ मैं, डॉक्टर सर के साथ।
अच्छा अच्छा ठीक है ओके।
ओके, सो कैन यू स्टार्ट?
यस सर।
Okay, so I thank you for support my speaker, rabies, anti-rabies is Mr. Nitesh Agrawal sir, based at Anand, and specialty is a surgeon, and more than 20 years is a practice in Anand, and is a leading doctor in Anand, and already is a prescribed in a rabies, and already is known what about the rabies and what about three dose compared to 5 dose. So I request you hand over to session Dr. Nitesh Agrawal sir, please sir.
Hello. Hello.
Doctor sir is a speak. So everybody are sound is clear.
यस सर
Hello?
यस सर
Okay.
यस सर।
हाँ सर जो बोल रहे हैं वो सुनाई देता है ना?
नहीं सर, अभी आवाज सर म्यूट पे एक्चुअली।
हाँ तो
सर
वो
ने शुरू
अनम्यूट,
किया।
हाँ सर ने शुरू किया, अनम्यूट नहीं हो रहा है।
अच्छा, टेक्निकल प्लीज अनम्यूट सर। हेलो।
Yeah, just a minute.
टेक सपोर्ट टीम, हेलो।
Yeah, I've done it. Hello.
ओके सर, नाउ वी आर एबल टू हियर यू।
Hello.
हेलो टेक
Hello.
सपोर्ट।
Hello.
This is Dr. Nitesh Agrawal. I am a general surgeon practicing in Anand from last 10 years and have been practicing surgery for last 20 years. I have been told specially to talk about the newer research done by on rabies, which will be related to the G protein, made from G protein, which has made the treatment much easier for the patients. So this new vaccine, as we know, the first slide, please. So second slide again. So globally, approximately 50 to 60,000 persons dies of rabies even today. Which, and even after having so many advanced treatments available, but the only thing is that in rural areas we are not able to find these treatments so easily. So these dogs we know have become means in India particularly we find so many street dogs. Even the pet dogs are so much exposed to the street dogs that they, when the pet dogs become rabies, we don't know. So approximately 20,000 people in India only die due to rabies even today. So when we have reached the moon, and if we are dying of a disease which can be cured easily, we should definitely be thinking of something new about it. Most of the deaths which occur in India are in the rural areas, as I told you that the number of doctors are less, or the availability of the medications in the government hospitals, CHCs, PHCs are very less. So next slide, please. So what we know about rabies, we'll talk little about the initial rabies part. Next slide, please. So whenever a person gets a bite from anybody, a dog which he does not know is rabbit or not, the first thing what we tell everywhere is first aid. So the first and foremost thing for any person, while for the general public, what we can teach is that the first thing to be done is to wash with a running water with soap and disinfectants. So they should wash as much as, it is told that it should be washed for approximately 15 minutes. So most of the viruses are washed out. The second part is the treatment becomes is active immunization and one is passive immunization. So we'll be talking only on the active immunization today, because that is the research done by us related to that. When the active vaccine started, we all knows the पेट में 14 इंजेक्शन लेने पड़ेंगे. That was very commonly we told. But initially it started with 31 doses of vaccine, which changed to 14, and then the standard what 90% of even we doctors know is 5 doses of vaccination to be given. So vaccination is very important in any street dog bite or even any dog bite which we don't know 100% whether is it a rabid dog or not, or the best. Or we see sometimes whenever we get a dog bite, so we don't know, we are not able to follow the dog, because usually the dog dies after 7 days if it is a rabies. So we tell the people that if you are rabid, after 7 doses, you can omit the last 2 doses, but most of the patients are not able to know the dog which died or not. So what we tell the patients is, can you complete the full dose? Over the years, we have come to know the most important thing in most of the patients who have even died or developed rabies is due to the non-compliance. One more thing about rabies is that sometimes if the dog bite has happened today, the symptoms may start after 15 days, 1 month, 2 months also. So any person who has a dog bite and the person does not know whether the dog is rabid or not should have a active and passive immunization. Next slide, please. So the initial what we know was the 5-dose treatment on 037-14-28. Again, what I told was the PEP is post-exposure prophylaxis. Prophylaxis because we don't want the patient to develop a rabies, because till today we know that rabies, if it is a rabies, if the patient develop rabies, 99% chances are that the patient will not survive. So the present vaccine which are available is like cell culture vaccine, and it is a more than 50-year-old technology. Again, the stability of the vaccine, the availability, the local and systemic side effects are also little high. So next slide, please. So related to the compliance, we told you that if the patient takes the full doses, the 5 doses of that, the chances of the patient developing rabies gets very low. But what we find, most of the patients mainly the patient who come from rural area, villages, they are not able, they don't take the full dose because most of the common thing is they forget the dose, they don't have money or to travel to the hospitals, or there most of the thing in India what I find is they, when they reach the hospital and they come to know that they don't have the dose for today. Next drop, next slide. So this study which has been shown limitations of 4 days, 4 doses of WHO recommendation, it's probably a very old one. So nowadays what we give is a 5 dose only. So what we know that this cell culture vaccines, even after some patients like 7%, 6.7%, even after 4 doses of these patients, six of the 90 patients did not develop a immune response. Next slide, please. That means that patients does not always have a full, even after the optimum dose, does not develop the full antibody levels which are required. So if that patient had a rabies bite, then he will still develop rabies even though he had taken the full dose of vaccination. So now what we think, what we see, so what we, just a second. Huh? This is a study which is showing that a patient had a 3 doses of different vaccinations with immunoglobulin, without any immunoglobulins given locally. So it is just the same findings that there are chances that some of the patients may not develop enough immunoglobulins to fight against the disease. Next slide, please. So this is again a research which was done, which showed that 53% of the patients were non-compliant to the full course of ARV. So they and most of the people took the initial doses, but they were not able to take due to some reasons, which I'll be talking in after some slides, that they are not able to take the last few doses of the vaccine. Next slide. So as we see here, on day 1, when the history of exposure is there, most 100% of the patients had to, because these were the studies we started. On the 12% people left did not come for the second dose, that was on day 3. Again, we lost 3% of the patients on day 7, 30% loss on day 14, and the loss means loss for follow-up was 40% on day 28. The patient did not take the last dose. That might be one reason, that the patient must have seen the dogs to be living, but they did not contact the hospital. So it is so that approximately 60% of the patients do not come for the last dose of the vaccine. So we go for the next slide. So again, this was the study what showed that interference with school timing was in 11% of the patients. Distance, like a rural person does not have enough time or enough facilities to travel to the CHC or PHC where they can get the vaccine free. So they were 11%, some 13% were due to the cost, and 18% of the people, they told that they forgot the date for the vaccine. Next slide, please. So now we talk about what evaluation has occurred. So we remember, again, I told the same thing, that 14, if you have a dog bite, 14 injections on your abdomen. I remember when I was in the medical school, the first thing in intensive what we used to get was, we were posted in the emergency hospitals, and there we used to have hundreds of patients, and the first injection which I even gave in my life was a intramuscular anti-rabies vaccine. So they were nervous tissue vaccines initially. Like I told you, the initial first vaccine which was developed was a live attenuated vaccine developed from the spinal cord, and it had to be given 31 doses. Then came inactive vaccine made from the brain, which was 14 injections, which we all know and lots of people must have also given. Then came the inactive cell culture vaccine. So that was the innovation, because the injections were to be given in the intradeltoid region, and only 5 doses were required according to the schedule, that is 0, 3, 7, 14, and 28. So still today, 99% or lots of people have come to know about this novel 3-dose, but still most of the places the 5-dose vaccine is only given. But that is equally effective for treating rabies. But the newer, next slide please. So the newer dose which I'm going to talk about, I'll just give a brief introduction how the vaccine has been made and what are the advantages of this vaccine and over what time and what is the main benefits of this vaccine. I've been using this vaccine from last 2 years. I have 100% follow-up. Probably again, I am working in a urban area, so the patients are very well known and only 3 doses are required. The cost of the vaccine is little costlier, but if you think the overall traveling cost, the case fees and everything, it becomes cheaper only to the patient. So again, it is a virus-like protein. It is a vaccine made from virus-like protein. So it's a protein which has a small antigenicity of the bacteria, but it is not pathogenic. So it is a novel 3-component rabies V G protein vaccine made from that. Again, I like told it has to be given again in the deltoid region, intramuscular region over 0, 3, 7. So the main side effect of 14th and 28th day with the patient needs to come has not to be done. So the compliance becomes really good and it has given equivalent good results to the older doses. Next slide, please. So if we go to the technical part of the virus, so G protein is not a stable protein, but Cadila Pharma has developed it by stabilizing it and using the VLP protein, that is virus-like protein, particles protein, and using it, the virus, this vaccine has to be made. Again, I told you, like it, we can see that they cannot replicate and they mimic the viral antigenicity, but they are not pathogenic. So they bring a equivalently good immune response in the human body after it has been given in the intramuscular dose. So I'll now be talking in the next slide about the clinical trial which has been done. So the patients were given 2 doses or 3 doses of the vaccine, and the immunological study and the seroprotection was seen, which was equivalently good for all of the doses given to our vaccine. So next slide, please. So, okay. So again, a study was done over the next slide, please. So safety and immunological study for this vaccine given by a developed from the G protein was done. And the results I will be talking in the next slide, please. So total vaccine was given in 533 patients, and the 5-dose regime was given to 267 patients. All had nearly the same types of injury and everything. So the most common known drug, Rabipur, was used for the reference part, and total subjects were total 800. Next slide, please. So we compared the seroprotection on day 14th and 42. And what we can see that after giving these 3 doses, the protection at 14th day was 99%. And in Rabipur, it was 97%. After 42 days, that is probably 1.5 months, the was equivalent to 99% and Rabipur showed 100%. So it's just long, very small difference in the immune response. The local complications, if we think in the way of local pain, redness and swelling, all were less in this newer G protein vaccine. Also, the thing was the adverse effects were quite less. If you think about the fever part, it was only 0.4% in the newer vaccine compared to 1.5% of the patient having the fever part. The earache, headache, urticaria, joint pain, everything was little or plus minus. But again, these side effects seen in the patients receiving the vaccine is already very low. So the study concluded that, next slide, please. So that the novel 3 dose was not very inferior to the Rabipur vaccine. We will not say the reference vaccine. The local side effects were comparable or lesser than the Rabipur part, and the immunogenicity or the response was equivalently good to the 5 dose regime. So again, the next slide. So Zydus Cadila Limited, Zydus Pharmaceutical brought this new vaccine, which is having a very good response in all the patients. And it is a G protein made from virus-like antigens from Zydus. And it is really good, and it is giving good results to the patients. So, sorry, Cadila. I have finished my sessions. I would love to know if anybody has any questions.
Hello.
हेलो
हाँ मैडम.
सर सर चलेगा क्या
नहीं सर है.
अच्छा तो सर few questions I would just wanted to ask from doctor that
Hello.
hello sir. First of all, thank you so much for giving your valuable time to us, and I would also like to thank all the participants who have joined and they have gone through the entire session. The first question, which is very often has been asked from all the webinars which we were attending, that what is the basic symptoms like if somebody is suffering from, or they are getting this initial bites from dog. What are the symptoms which they can refer to as rabies? Because people are not that much not that much aware.
So the first thing which has to be remembered in any case is that if there is a dog bite, though the patient we know, even though we know the dog is vaccinated, non-vaccinated, street dog, and we never know the exact status of rabies. As a doctor, till today, I have told only one thing: any dog bite, you should get vaccinated, because once the symptoms starts, the symptoms initially started are fever, urticaria, you start having itching, you start having some common cold, irritation. But once you start, because once the virus reaches the central nervous system, then probably it is very difficult for the patient to be saved. The most important symptoms what we know is phobia. So they start having hydrophobia and aerophobia. So the patients become very irritable, and they start vomiting, and they start, even when they see the water, they like to be in the dark. If you put them in the light, or if they see water, they typically start shouting and doing all the wild things. So this shows that the central nervous system has started getting involved. So the initial symptoms are like any fever or any common cold like things.
Okay, sir. Okay. And sir, as you have been you have used experience over Travis. So have you seen any changes in the patient? Like for 5 dose, we have seen that there are studies that people do not go for the 5th dose, of even the 4th dose or 5th dose. The chances to get the dose is very less. So for 3 dose compliance, is there any feedback from the patient? Also, from your point of view, like has done better than, like how 3 dose is better than 5 dose?
So I am working in a private hospital in a urban area. Frankly telling, see, what I personally feel is explanation to the patient. So I don't remember any of my patients leaving even a single dose. So most of the patients are worried about themselves. So they usually come. Yeah, but definitely lots of patients who come for the first dose at my hospital, because they come with an injury, they come with a bleeding, they come with bad wounds also. So the best thing in India, one of the very good things in India, that this rabies vaccine, Rabipur, or I don't know the company, but government hospitals provide them for free. So the poor patients usually go away to these government hospitals for the next doses. So I don't remember if they are taking them or not, but the urban patients, they usually take the full course, even if whenever it was 5 doses or it is 3 doses.
Fine, sir. I'll check few more questions and I will ask from you, and then we can end the session, sir.
No issues. Video channel. Acha, pardon,
Sir, one question is there that suppose 5-dose vaccination somebody has taken and they have
Sorry,
taken only 2
can you repeat?
five, it is going for 5 doses. They have
Yeah.
completed 3 days, that they have not taken. So is it possible to get rabies symptoms after 3 months or 6 months? Is it possible that they have not completed the course? So is it possible that it can come back?
Yeah. So what I told you was, see, if the dog is living, if you can identify the dog living after your 3rd dose, so usually any animal, the incidence of getting rabies in India via bat, rat, monkey are very, very less than 1%. 99% of the patients in India get rabies from dog bite only. So if you find you find the particular dog after living after 7 days, we recommend that if you don't take the 4th and 5th dose, it is okay. Yeah, but what we have seen that if the dog bite is from a rabies vaccine, and if you take the 3 doses, the immune response is not 100%. So definitely the research says that if you are not taking the 5 full doses, even if you see that our vaccine, that is Thebris, has 98.6% at 42. So 1.5% patients may even not develop good immunological response after 42 days of days. So definitely there is a chance of the patient getting rabies symptoms after 3-6 months if he has not completed the full dose.
Thank you so much, sir, for this valuable conversation. And it is our pleasure to have you taken your time for this webinar. And also, we want to highlight that our service has won Innovation of the Year award for technology. And one more thing we want to highlight that we have also won Golden Tigers Award Malaysia for our service. So to all the participants who are on team, thank you for making this valuable time. And thank you, sir, for this valuable lecture which you have given. All the slides were very clear. And the most important thing that you have shared is your personal experience, which is the most valuable thing for us. Because I know there are certain studies will go on, and we all understand that yes, there are theoretical things will be there, but doctor's experience is something which is at par. So you know very well like how patients feel and how difficult to what are the challenges they face for 5 doses in 3 years. So thank you so much, sir, for your valuable time. Definitely, once we are there in the future, definitely would love to visit you. And thank you for supporting Fabric also.
Thank you.
Thank you so much, doctor. Thank you so much, doctor, for the informative talk. And we truly appreciate in front of Cadila Pharma, on behalf of Cadila Pharma, your efforts. Thank you very much. As you have already present in your presentation, there's Travis have won 2 innovation category award, ET India Pharma Award and Golden Globe Tiger Award. So once again, thank you very much to all the delegates who has joined. Thank you very much, Parul ma'am. He has joined from PMT Cadila Pharma to support us, and technical staff, our technical staff. So thank you very much, sir.
One last thing is,
Yes.
the really appreciable thing about these good companies is that you people you put lot of your income in the research, and that is why we doctors get good name and good patients also. So all the companies who are doing research work should be thanked a lot also.
Thank you
Thank
so
you,
much.
sir. Thank you. Thank you.
Thank you so much.
Thank you so much, Parul madam and Tarak sir, and very thankful for
Agrawal,
Dr.
sir.
Nitesh Agrawal sir, and all participate doctors. Thank you so much. So,
Okay, sir. Now we conclude.
okay.
Tech support, we can close the session.
Yes.
Hello. Tech support.
Hello.
We can
Ah.
close the session.
Okay.
Thank you.
Thank you.
Thank you.